Hello, everybody, and welcome and good morning or good mid-morning on this February day. We're now going to go through some homeopathic remedies for dental matters. And these are amazing. I've seen personally very good things happen with these. And these are drug-free. They are not steroids, they're not antibiotics. It'll help you reduce pain, take away the dread of dental procedures, and really help with the healing. And so we're going to start with everyone's dreaded fear, and that is going to the dentist in the first place. And aconite is your remedy for that. Aconite is very much your remedy for that. People have an inordinate fear of going to dentists, rightfully so. I hope you never go to dentists. You don't need to get cleanings. You don't need to get root canals. You don't need to get implants. What you're going to the dentist typically for is to get previous procedures redone so that you gain your health back. And a lot of people in the 70s and on, the dentist recommended getting wisdom teeth pulled out instead of having the jaw expanded to accommodate those wisdom teeth. And so comes a time when those get infected and you have to get them cleaned out. Anxiety is a big thing. Aconite is a wonderful remedy. 6C, 12C, even 12X in the X potencies is wonderful for fear, panic. If your children are very terrified of dental procedures, and I hope that they're never taken to a dentist. In childhood, you want to give them raw milk because their first teeth are going to fall out. You don't need root canals and crowns. You know, I see people who have done that, and it's just horrifying. If you get anxiety with diarrhea, gelsemium is a great anti-anxiety remedy and will help calm you down. If you have nausea, if you are high-strung, irritable prior to your dental procedure, Nux vomica is a good remedy. And the kids that hide behind their mother's legs, that's Ambra grisea kids. Those are burrito carp or Ambra grisea kids. And when they're extremely nervous at the thought of this, Ambra grisea is a wonderful remedy made from whale grease. Coffea cruda works really, really well when you're stressed out, when you have many ideas that are simultaneously, making a homogenized soup in your head. You can't sleep the night before. You have extreme anxiety, Coffea cruda. And different things work for different people, folks. People have a different types of anxiety. My anxiety, aconite works very, very well for me. Children with anxiety, creosotum. Pulsatilla is great for kids, maybe girls, who are very shy and sensitive, and they just don't want to be faced with procedures. So know your remedy, get your kits, and before your procedure, get help. Any questions on anxiety? No questions. The next set of remedies is for gums. And too many people have swollen gums, red gums, bleeding gums, cancers of the tongue. Apis mellifica is great for that. Arnica for if you have trauma in your jaw, the first thing you want to do is arnica. You can take Apis mel for swelling and redness and soreness and stinging and burning and itching. You can take arsenicum album if you bleed a lot. If you bleed a lot, your mouth is dry, ulcerated, your teeth hurt, like you have neuralgic pains in your teeth that are worse at midnight and later. You go to bed and you wake up midnight, 1 o'clock with a whopping pain in your teeth. That's an arsenicum or a metallic taste. Belladonna is when it's throbbing, when your tooth is throbbing. You may have an infected abscess. You may have fever and you're swollen and throbbing. So those are sort of the rubrics for a belladonna gum. Your gums are swollen. If you have sores or receding gums that bleed very easily, echinacea is a wonderful remedy. Cracks at the corners of the lips, Condorango is a wonderful remedy for that as well. And I should add it because I can. 3x, 6x, low potency for cracks in commissures and corners of your orifices, whether they be dental orifices, whether they be anal orifices, vaginal, mouth, nose. If there are cracks, Condorango is a good one, and as is nitric acid. I'm going to say nitric acid right here as well. And when you look at these things, take the time to look at the materia medica of these remedies and be informed and see if that picture applies to you. And you might feel overwhelmed in the early going, but these will pretty soon become your friends. I have misspelled commissures. Anyone tell me how to spell commissures? I think yes, 2 S's. Okay. If you have poor gum tone, your gums are kind of flabby. Can you see my face? People see me or no?
Yes.
Okay. See, when you press your gums, you have poor gum tone, flabby gums. After brushing, they bleed. Ferrum phos. You might have anemia. If you have ulcerative tissue, like swollen gums, you have had trauma or injury, or you're diabetic. I see a lot of diabetic people with swollen and ulcerated gums. Kali chloricum is great. If your mouth stinks, if you have cold sores or thrush, white stuff in your mouth, Kali Muir is great. And you can use the cell salt, or you can use just the straight remedy, homeopathic remedy, which is higher potency. If it is an actively suppurating tissue, then Hepar sulf is wonderful. Hepar sulf and silica. And consider here silica as well.
What does suppurating mean?
Suppurating means leaking pus.
Okay, thank you.
So Hepar sulf high, you take it in a high dose if it is not yet suppurating. It's trying to turn into a boil. But once it starts to suppurate, take a low potency of Hepar sulf. I have this salt, Hepar sulf, 6x or 12x, and that's great to get it out. Same thing with Cilicia, if the symptoms match, a low potency to get suppurating boils and abscesses out, to get it moving again. And the key is not to suppress, guys. You can either abort by increasing your immune system, or you can let it come out, bleed out, suppurate out, let the pus escape. Kali phos is great, not just for nervousness, for bad breath, for dry mouth in the morning, for spongy bleeding, receding gums. For me, if I have bleeding in my mouth, phosphorus works like a charm. And I'm going to add that, especially phos, bleeding in mouth, gums. It just works like magic for me. And what has worked like magic is 12x to a low potency of phosphorus. And that could also be because it is part of my sort of constitutional remedy as well. It was my remedy for pneumonia, for COVID pneumonia, and it saved my life. So phosphorus really works for me. But for you, it might be something different. It might be Kali phos. So experiment a little bit. It will not kill you because these are not antibiotics. If you have purulent, like deep, yellow-green pockets filled with pus, no abscesses, Kali carb is a great remedy. Creosotum is a wonderful remedy for dental problems, black teeth, swollen spongy gums, cold sores, cracked lips. It's a great remedy in discharges that are sort of involuntary as well, like you're lying down and you need to urinate. You're lying down and your menstruation. So discharges that begin when you're horizontal are great. Great indication of creosotum. So these are remedies that are good for your gums. More core. This is very advanced gum disease with swollen, inflamed gums, and it hurts. it hurts and it throbs, and inflamed. They're inflamed and maybe bleeding. Merc salt, same thing. The mercurious salts are good for if you have discharges that are bloody, light greenish to lightish colored. Merc salt is good. A lot of us have been poisoned by mercury. That we have amalgams in our mouth, and we have diseases related to mercury in our mouth. So merc salt is actually isopathic to the amalgams in our mouth, and you will see a great deal of healing if you have symptoms of mercury poisoning. If you see people with a blue line on their gums, they probably have lead poisoning. And plumum is a great remedy, plumum metallicum, that's lead. Like in menopause or pre or post-menopause, women have gums suddenly that start bleeding a lot, chronic bleeding, persistent bleeding after a tooth extraction. That's phosphorus for you. Any questions so far?
I have I guess a question and comment has to do with mercury in the mouth. You can take a homeopathic, you can also work at removing the source of the mercury, which are usually fillings.
Absolutely, yes. That's the far more important thing, the obstacle to cure. You can't keep leaking mercury in while you're taking homeopathics, because that's just a silly way to operate and it won't work. So get those amalgams out, even if it, it's work, it's work. And we did things we did, not knowing about them, root canals and amalgams and implants and all that. Once you got them out, the remaining traces of mercury can be removed with a bunch of these remedies, which really work well. If you have sore gums, loose teeth, pain around the joints where the teeth meet up with your gum sockets, that's a rust tox. Cold really bothers your teeth, that's rust tox. Silicea is a wonderful remedy for suppurating pockets, swollen glands in your mouth, and it just gets it out. If you have splinters and other such bones stuck in your mouth and don't know it, silicea. Sulfuric acid is another good one for cold sores. Staphylos aureus is good for loose teeth. And again, look at the whole remedy picture. Do you fit Staphylos aureus better? Do you have loose teeth and a lot of pain in your mouth, and you're feeling a little bit angry that your neighbor said something and you are not able to report back? So it's a state of mind that you're in. And all of a sudden it's expressing itself in pain in your teeth or loose teeth. That's a Staphylos aureus moment. If a golf ball hits your mouth and your injuries to the root of your tooth and all that, periosteum symphytum is wonderful. If you have cancers of the periosteum, you catch them in the early stage, symphytum will really help. Where a trauma turns into a bubo, which turns into a cancer, which is probably what happened with our dog, Roxy. Yes. Any kind of injured bones in your jaw, your teeth where they attach to your jaw, Bruta is a great remedy. It'll stop the pain. And then Tuya and Trillium. Trillium is for excessive bleeding. If you have a lot of bleed, it's a great uterine remedy too. Postpartum, if women just don't stop bleeding, think about Trillium pendulosa. Excessive bleeding after tooth extraction, bleeding gums. It has a headache in front of the head. And so these are the kinds of remedies that we're looking at for dental stuff. So the question you have to ask yourself is, do I get anxious? Keep a remedy or two. You don't have to go all out, and your kit should suffice. Do I have gum issues, or do I have boils and abscesses? Just keep, Hepar salt. If you don't want to keep 20 remedies, keep Hepar for abscesses. If you have a lot of salivation and you have salivation and dental problems, Merc Sol or Merc Core corrosivus are probably good remedies to keep. If you, like me, sometimes bleed easily in the mornings, phosphorus is a good remedy for you. So just keep a few. You don't have to go overboard and buy 20 remedies. Caries, dental caries. This is decay in your teeth. And Calfluor is a wonderful cell salt. You can take it in potency as well. Calcarea phosphoricum is virtually a magic bullet for children that are growing up. Girls between the age of 9 and puberty, or 8 and puberty, boys that suddenly grow 2 feet, everything is growing. Or children that with dentition, CalPhos will help relieve the pains, the teething troubles, get your kids good teeth, help your teenage children in their growth stages when they have bone pains at night. You know how they're howling? CalPhos, given every day, twice a day, cell salt will work like magic. And I wish all moms knew that. Instead, they give all sorts of, things, allopathic medicines that are just bad, that are not tonic, they're not healing. If you have deep decay close to the pulp, then mac carb is a great remedy for a decay if you suspect it. And many times you can dodge tooth decay. You can avoid getting your cavities filled by using some of these homeopathic remedies. But the key to remember is none of it's going to help if you don't have a good diet. If you don't have your raw milk or your raw cream or your yogurt or your calcium-laden fermented foods like cheeses, raw cheeses. So please, please get the raw materials, and then the homeopathics will help your body assimilate them. There are people who have cured cavities, bad decay in teeth, and managed to survive with food and homeopathy. Floricum acidum, very excessive decay. Typically they might have skin problems and such. And so you have to look at the person and look at the remedy. Then we look at the, yeah.
A question, if someone has an infection and you take the homeopathics, does it actually remove the infection or does it treat it? How to explain that a bit?
The homeopathic will remove the infection. It'll help your body heal the infection. If it has not suppurated, it'll abort it. If it is suppurating, it'll help to get it out and clean the infection out.
Great.
Without antibiotics. What happens with antibiotics is you're eating, very, very sugary foods. You keep getting decay. You get infections. You take antibiotics. It wipes out the good bacteria in your mouth, which actually help with the digestive process, wrecks your mind, wrecks your gut, and the infection repeats itself. So never, never take antibiotics into your mouth for anything.
Thank you.
MRSA, we have a lot of MRSA on people's faces, mouths, tongues, only homeopathy, guys. That cocktail of antibiotics is working less and less, and people are literally having their body parts amputated. Let's not contribute. Yeah?
I have a question.
Sure.
Regarding Calcarea phosphorica and Calcarea fluor. So if for the growing children, if there is no sign of caries, still they should be given, or it is only indicated when there is caries?
Any growing children, I would give CalPhos from time to time, and especially when they get up at night and complain, mama, bones are hurting, or if they're growing very fast. What you're going to do is you'll dodge all these troubles.
Okay, so one pill is enough, like one pill of each.
Yeah, a couple of pills in a water dose. You just put it in their water bottle. You can add it to their water bottles.
So that should be on a regular basis, or it's like only when they tell of any pain or any tooth issue or a bone pain?
I would say if they are telling you about bone pains, then you make it a regular for 2, 3, 4 months.
Okay.
And if they are perfectly healthy and their teeth are beautiful, then you can get away with not doing it. But when children are growing, they need all the help, mental, physical growth. And when they're going through a growth phase, I would just do it. Once a day, twice a week, thrice a week,
I have a question.
Thank you.
Thank you. A question about preverbal children. I have some neighbors who have preverbal. One child is preverbal. How does a parent know what might be going on with teeth or bones or anything related to it?
Very good, very good. When a child has toothache, he's going to hold his mouth and cry. If they have a headache, they'll bore their head into the pillow and cry, or you can see the distress. 90% of the things that are happening to children, you can observe. And if you develop a sense of observation, you'll be able to spot on anything, and mothers and parents are tuned into their children. Actually, I take that back. They're not tuned in. They have been taught to take them to a pediatrician and not trust their own judgment. So the best thing you can do for your neighbors is look at the children and say, look, did you notice that this is happening? Did you notice that this is the case? And can I recommend homeopathics, which are safe and effective, and see what happens?
Great. Thank you.
And you'll develop a sense, homeopathy is not psychology, but because it's really based on actual symptoms, but it can cure so many psychological issues that it's incredible. The other day, I was going through a period of grief. My daughter's in New York, just going through hell. She's going through hell. And you have this feeling of utter helplessness. I couldn't sleep. I was restless. I was pacing back and forth, annoying Richard and really stressing everybody out. And I even forgot, I took literally two poppy-sized pills of Ignatia. A calmness came over me. I said, this storm will pass, one thing at a time, one step at a time. We're getting what we need. And the situation doesn't change, but your attitude changes dramatically. And even if just mothers, the parents or the caretakers took these, it would have a huge effect on the children, the people you're taking care of, and so on. And you forget, when you're in that state, what I'm trying to say is, when you're in a state of anxiety or fear or grief, stop for a second, look out the window and say, what do I need to do? And just pop it, whether it's aconite or aurum metallicum or Ignatia, you will feel amazing. In your children, you have the ability to observe them very, very closely. They will tell you, Mom, could you press my legs? Or they come home from work and they have all this homework piled on and they're just stressed out and they develop a headache. Picric acid is a great remedy for headaches of kids taking exams. So you want to have it on hand. They might go out and play a lot. A lot of parents have their kids in wrestling and taekwondo and soccer, and they come home and they're literally hurting. So arnica, ruta, calphos for growing bones are fantastic for that.
May I add something?
Sure.
You said something about, you used the line that was in a movie I just had seen, and it was, the storm will pass, or the storm shall pass. And there's a movie that I'd like to recommend for everybody. It's on Apple TV, so it's on the computer. It's called The Boy, the Mole, the Fox, and the Horse. And it's a wonderful, uplifting thing. For example, the mole asks the little boy, what do you want to be when you grow up? And the little boy pauses and says, kind. So, it's that beautiful philosophical, but they were in a big storm and the horse said, the storm shall pass. And what you need to do when you feel like things are out of control is look for the thing right under your nose that is beautiful and focus on that.
That's so beautiful. That is so true.
So it's what you were saying, looking out the window or looking, wherever you look, it's right there and it's beautiful. So I just want to recommend that movie. It's also a book. It's a 34-minute movie. It's easy to watch and it's beautiful. So
I will watch it. Thank you. Thank you. I need that.
Good. Yes.
Yes. Thank you so much.
You're welcome.
So yeah, don't forget, guys, you have homeopathy at your disposal in the worst moments of your life. My daughter has lived on Ignatia and aconitum, and gelsemium for the hearings, and aconitum when we lost or were shocked, and more, and gelsemium, and it's really helped. She would have been a basket case without homeopathics. I would have been a basket case. So the situation doesn't change, but your attitude changes, and that's everything. Floricum acidum, floric acid. It's wonderful for extensive decay in skinny, sort of malnourished looking kids who don't assimilate food well. Calcarb, when you have a child that's sort of sluggish and sort of chubby, it sweats a lot in the head, and is having dentition problems. The teeth are not coming out, or they're coming out bad or crooked, and the new teeth are having troubles growing. So calcarb is a great constitutional as well. Calcarb is a wonderful remedy if you have hay fever, allergies. One of you has a son who has allergies. I know so many people with allergies. Calcarb 200 taken every 3 or 4 days, or even twice a day if they're severe, with belladonna 3C will in due course improve their immune system and constitution to the point where they can deal.
A question, Sushma. I know you recommended different doses and at different times, like take this 3 times a day, or take this every other day, or take this once a week. Other than consulting you or another homeopath, how might we judge what to take and how often?
That's a very, very good question, and people ask it all the time. And part of the reason they ask is fear. They're so used to having a doctor prescribe antibiotic doses this many days, no more, no less, that they're afraid to check in with their body. When I took the Ignatia, I took 2 little poppy-sized pills, and within 10 minutes, I had peace of mind. Literally, I was sitting rocking, Sunshine, in your chair. I was sitting there rocking. I said, oh my God, I feel different. I didn't need to take another dose. Done, finished. If you don't feel improvement, then take another dose, but give it some time to act. If it's the right remedy, it'll act very fast. And you can repeat it or not. You can take it for a longer term. There are many people who say you cannot repeat a 200C remedy or 1M remedy. It's a lot of isms, but homeopathy is very forgiving. People say you can't touch it or touch the pills. I routinely put it in the dog's foods and it worked just fine. You can, if you have someone who will not take pills, like someone who's psychotic or who has psychiatric problems, you're going to slip it into their food. And it works very well. If someone's having seizures, you give them cuprum metallicum in their water or their milk or whatever food, the food they're eating works. And so at some point you will be confident, have the confidence in yourself to judge, okay, I'm done. This has either worked or not worked, and it's worked to the point of amelioration. I don't need it anymore. But in homeopathy, once your improvement begins, stop the remedy. Restart it only if the improvement stops, and don't immediately switch to another remedy. You might need a higher potency in the same remedy. And does everybody know how to make a higher potency, guys?
Yes.
Okay, so you've taken a 30C in a bottle, you've exhausted it down to the last 1 millimeter, you add more water to it, and you succuss it 40 times. That's your next potency. And you can continue to increase the potency thusly, but so long as you know that when you add a lot of water, you got to succuss it vigorously. You go bang, 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 and that's your next up potency. Does that kind of answer your question?
It does. It leads me to another question, because you mentioned succussing a mixture, and I've done it anywhere from 15, 20 times to 40 times. And I'm not sure if I do it 40 times, does that increase it even more than I do 20, or if I do it 60, all that kind of questioning.
Yes, there's no, you don't have to be precise. Even if you succuss it a few times and just take it, it's good. But the more you succuss it, the more dynamized it's gonna get. You know, you hear about water with all these properties, and it does change completely with succussing. The H and OH ions kind of separate. It has a structure that varies by the remedy that's put in under a spectroscope or fine photography. You can, it's just amazing, the science of water and the science of these nanoparticles in water, and how our immune system recognizes them, and how Hanuman actually figured this out is kind of magical, actually, 300 years ago.
Great, thank you very much.
All righty, pain. Aconite, arnica, antimonium crudum. If it's worse at night, aggravated by heat. Arnica, you're very familiar with. Aconite, suddenly, it's icy cold outside. You come home with a toothache that just about kills you. Neuralgias, winter neuralgias. You go out and your cheeks get touched by freezing cold. Aconite. Arnica, you know, trauma, bleeding gums, ulcerated tissues. Calendula is also great for ulcerated tissues. Belladonna, if it's throbbing, worse when pressure is applied, motion, touch, chewing. Bismuth is a wonderful remedy where your teeth actually feel better with very cold water. And you have swollen gums. So look for the peculiar. If normally warm soothes, but now cold is soothing you, look at the remedies that are better with cold, such as bismuth. Yeah.
Another question. I know over time you've suggested certain medications, homeopathics, that are for a specific purpose, but they also have, I guess you'd call, other purposes or affect other systems. How, other than, again, consulting someone such as yourself, how would one know those other than looking it up in a Materia Medicum?
I'm afraid that's the way to look it up in the Materia Medica. There's something called Allen's Keynotes, which are much shorter, and you can find them, H.C. Allen's Keynotes. So it's like a short Materia Medica that highlights the main points. But the point here is your toothache gland is the entry point into your body and soul. And frequently the remedy that works for your toothache is the remedy that will do the greater good in the other conditions of your body and your vital force. And so, you know, you don't have to spend your time fussing and thinking and debating about the merits of this remedy and the rest of your body if you have a simillimum that's pretty close in the presenting complaint.
Yes. Okay, good, thank you.
And this has happened with, you know, this homeopath by the name of Rajan Sankaran was talking about this kid with psoriasis and eczema that wouldn't heal. He tried all the Sorinum and sulfur and this and that. He wouldn't heal. And then he got a convulsion. He convulsed and was unconscious over something. Someone yelled at him. And he gave him Veratrum album, which is for coldness, loss of consciousness, just prostration. And he gave him a Veratrum album, and that cured his eczema. So frequently, you're not a magician, but frequently the presenting symptom will guide you to the remedy that's actually acting in a much deeper way.
Good.
Calflor for loose teeth, toothache when chewing, teething pain, your enamel feels kind of rough and deficient. Chamomilla, toothache which intensifies with warm or hot drinks or food, or children who scream in pain when they're teething the first time in their lives. Chamomilla. Coffea cruda is actually worse with heat, so it's the opposite. It's better with cold water, holding an ice chip in your mouth. That's the Coffea cruda pain. So if your child feels better by holding an ice chip in their mouth, Coffea cruda might be the remedy for them, not chamomilla. Hypericum is for nerve injuries, and everybody knows that. Just dental nerves are just horrifyingly painful. You get trigeminal neuralgias, which are horrifyingly painful. You get back injuries. People trash their backs. And if you have pain in one spot and it's radiating to another spot, that is hypericum. If you have an abscess in your right molar and your left shoulder hurts, consider hypericum, because the pain is radiating deep through your nerves, has infected other parts of your body. Hypericum. And this applies yeah.
I have a question about hypericum, not related to the dental part. Uh, does hypericum work in numbness also? Like one of my friend, a month back, she had a L5S1 discectomy. The prolapse disc pain has gone away completely.
Okay.
But what has come up is, she says, post-operative, within few hours, she started feeling numbness on one of her legs, and it goes along the distribution of these nerves only, L5S1. And I had a chance to examine her, and I could see that she literally feels only 10% of light touch on her toes, the fifth toe and the fourth toe. So will hypericum work for numbness? Like, I told her to take hypericum just like that.
Absolutely.
But then I was wondering whether, because hypericum was more for radiating pain, and this was like, she feels
numbness
paresthesia.
Numbness is anesthesia of the nerves, and hypericum will absolutely help. If she was knocked out for the surgery, the numbness will also be helped by phosphorus, large doses. It could be paralysis, so phosphorus, hypericum, depending on how they present. If she got general anesthesia, try phosphorus before you try hypericum, and then hypericum. Great, good thought thinking.
Okay. She can take with 30 or 200.
Yep.
But I don't know how I'm going to convince her to take homeopathy. But she is in a really bad shape because it's been more than 6 weeks now. And she says it just keeps on. It's more of like sometimes numbness, sometimes it's like paresthesia. She gets like electrical sensation.
Oh, yeah.
And that, she says, the worst is in the night when she lies in the bed. Probably that's when the entire spine relaxes. That's what I feel. There's no guarding happening. And then she feels I get more sensation from my leg.
I see. Yes. First, there's two things here. One is address the etiology. Etiology means the causative factor. If it was caused as a result of the drugs or the anesthesia, and also just the paralysis, they may have damaged the nerves. Phosphorus is a very good remedy to open it, and then hypericum high, 1M, 10M. And if you keep some on hand, you can give people water doses.
And
so when if it is a
cause because of the operation, you mean to say like it could be anesthesia, or even if suppose they have touched the sensory part of the nerve?
Yes.
That could be the cause, right?
Either. Yeah, it could be either.
For that, it should be phosphorus.
Yeah. Start with phosphorus and go to hypericum. And when a person is in that kind of pain, they'll try anything. So a combination of hypericum, a Staphylococcus aureus, if it was a cut that did it. You know, when I got gored by the cow, the only thing that helped me was Staphylococcus aureus. It was like I was wounded from the inside. There was a wound on the inside of my belly, a cut from the goring. And it just instantly, the burning pain would go away. It healed nicely. And now the tumor, the contusion is almost gone. So Staphylococcus aureus, phosphorus, I would invite you to try the remedy mixture of Ruta, Staphylococcus aureus, hypericum. Land, you're using that, right?
Yes.
Yeah.
Okay.
If she's a person who doesn't like to take 5 different things, mix it by all means.
Okay.
But do the phosphorus separately.
Phosphorus, yeah. Thank you.
And injuries in surgery are Staphylococcus aureus, Ruta, symphytum, hypericum, calendula, if there's laceration. Wonderful, wonderful remedy. And you know, there are people that sell these remedy mixes, which are very low potency each. And there are these Narayani remedies, which are very high potency, 50M and 10M and all that. And there are various schools of homeopathy that are just horrified by some of these things. They're horrified by the Banerjee protocols. They might be horrified by the Narayani remedies. Let me tell you one thing. Anything of this beats antibiotics, Tylenol, Panadol, paracetamol, steroids, chemotherapy, radiation, and surgery. You can
Why
screw up.
horrified?
Yeah.
Horrified meaning?
Horrified meaning if you don't like the thought of using multiple remedies, or if you're not confident that you're using the right remedy,
Okay.
it's very safe compared to the alternatives.
The word, all the words you just used have the word mal at the end, which I think means bad.
Yes.
Isn't that?
I think of that.
Mal a la tête. You know, I've got a pain in my head. Mal is bad.
Yeah.
So that's interesting.
Yeah. So true. So true. Okay.
For injuries, even Bellis perennis works, right?
Yes, that is for old injuries. It's like the gardener's injuries. You yank out a root, you do it again, 6 months later, it hurts like hell. Old gardening injuries. Labor, after labor, a woman needs deep-seated healing from pain. If you've had
Scars. Okay.
yeah, scars, just injuries, just the stress of having labor. And there are many people who never recover. So their uterus hurts, their back hurts, their, one dose of Bellis perennis. I have 50M. I have Bellis perennis 50M, and it has worked magic on people's broken backs, broken and sciaticas and radiating pains. It's like the long-term arnica. When arnica doesn't work, after 6 or 7 months, Bellis.
How do you spell that?
Bellis.
Huh.
And I believe your kit has it, Sunshine, the red kit,
Okay.
and possibly the gray kit also.
Another question. You talked a few minutes ago about using two homeopathics separately, and you said, friends, don't take them together. And others, you said, you can take that, as I'm doing now for my post-surgery, and I'm calling it a cocktail. Is there any guidance that you can share with us about when and how you do things separately or when you do things together?
Yes, there are some things that go very well together. They're called complementary remedies, or remedies that can be taken together. Over the last 300 years, homeopaths have discovered what remedies follow each other well, what remedies don't follow each other well, which remedies antidote the other remedies. And you can find that at the bottom of your Materia Medica description of that remedy.
Great, thank you.
And so just go by that. But if you have combinations, just check to see they don't antidote each other and separate those two, the ones that do. And even when they do, like people have, there is a rheumatoid arthritis remedy, a Banerjee protocol, which is Bryonia and Rus. And Rus is better when they're warm. Bryonia is better when they're cold. Rus is better with motion. Bryonia is better with no motion, with stillness. And yet, the Banerjees are saying you have to take them in alternation together, basically. And homeopaths are going, oh, that's horrifying. That is not the way homeopathy is done. But the Banerjees have been doing this for 150 years. What they find is, in that case, there are times, hours of the day when that patient just cannot move. That's a Bryonia moment. And there are times when motion makes them better. That's a Rus moment. So if you alternate those two, you're addressing the very core of that arthritis. And they've had fantastic success with this set of remedies that are opposing remedies, but they're taken in alternation. They're not taken together, however. They're taken in alternation. So you're not taking them at the same time. So a little bit of logic you got to use, a little bit of reading, but it's all good.
Just a brief follow-up. When you talk about alternating or taking separately, is there a time period where one is more effective than the other? If you wait 10 minutes, 15 minutes, 2 hours, so on?
Depends on what the situation is. In an ideal world, you know the exact simillimum to what's ailing you, and you just take it, and you know you're pain-free in the next 10 minutes. Oftentimes people don't know. They just don't know. And rather than reach for the Tylenol, it's better they reach for the mix.
Mm.
So always you want to think of the alternative. If I don't do this, and I don't really know which of these 4 remedies I'm taking, my alternative is a painkiller. What does aspirin do for sprains? It actually destroys your proteoglycans. So you sprained your ankle and now you're taking an ibuprofen, which is going to destroy your connective tissue. You're better off taking the mix.
Got it. Thank you.
So the alternating remedies are the remedies that are not taken at that particular moment,
Yes.
but they can be taken in the day. So if I
Yes.
feel like I can't move, then it's bryonia. But it's all depending upon what that person feels at that time, right?
Yes, yes.
Or is it
Or
like
not even. If you alternate it, it addresses conditions in your body that address those particular serous membranes, for instance, whereas rust tox might affect something else, your joints, you know.
okay?
And the proof is in the pudding. If the person recovers, you did a good thing. The other thing is there are many things which we don't know. Why does this work? And that's what the Banerjee's argument is. It just works. It works because we've followed the laws of homeopathy. We've looked at the antidotes. We've looked at the complementary remedies, and we're very carefully recommending this. And the reason we're doing this is we cannot take a case of a person for 3 hours because we're dealing with 1,200 patients in one day. Each doctor has to take 100 patients a day. So that's like 3 or 4 minutes per. And we want to get it right 90% of the time. And they do.
Are there certain homeopaths who follow the Banerjee principle and others who don't, either because of their belief or their
Yes.
training?
Yes, homeopaths are very set. Many homeopaths are very set and stuck in either Banerjee protocols or multiple remedies, prescribing, or classical homeopathy, or some combination, or homeopathy and herbs, or you know, it takes all kinds. And the thing is, you want to have an open mind, but you want to. The most important thing is to not take in poisons. Anything that's synthetic, any food that's processed, mercury, these are all highly poisonous substances. And if you can do anything to avoid those, then whatever you're doing is great.
You know, when you said that they, you know, have 3 minutes or however minutes, it makes me think that there must be an order of questions to ask people, because pain is a superficial word. We have to go deeper to understand what's bringing it about. But what are the questions that we need to ask to really pinpoint the direct reason for our pain or our nausea or whatever? Yeah.
That's a very, very good point and a very good question. When you're treating someone in 3 minutes, 90% of your work is observation. You got to look at their cough, look at the stuff coming out of their eyes, look at their temperature, the examination. If it is good and swift, and the Indian homeopaths are actually trained doctors who are also homeopaths, and you diagnose well and you've got all the ultrasounds or whatever, MRIs and all that, you know what you're doing. And once you do, then you prescribe. But if it's more mental symptoms, in the West, we tend to have more esoteric problems. The Banerjees are treating people from slums, a lot of people for free from slums. And, you know, they don't take Xanax every day. They don't take antibiotics. They don't have the money for that. They don't eat fancy food. So they eat that. So you cannot give them nutritional advice. But at the same time, you know that they're not wrecked with drugs. And so when they tell you a dream or they tell you a pain, there's very clear treatments for those. So I would say it depends on the civilization, the culture, where you are. And truly in the US, people are so messed up with layers and layers of just medical trauma, getting just I had a client with a husband who was on like 15 or 20 different drugs, and she's amazing. I said, go to Ask a Patient. Here's a homework assignment for you. Go to askapatient.com, plug in all his symptoms that he has on one side axis, and plug in all the drugs on the other axis, and then cross off the symptoms that he has against that drug. 99% of his symptoms were caused by the drugs. And when you take the drug away, the person is not dizzy, they have no headaches, they have no nausea, they don't have diarrhea. So we are very complicated by virtue of the drugs. So you guys are very unusual. You guys are the outliers. Most people that I have seen or met, especially people over 70, are on statins, BP meds, Prilosec, did I say BP blood thinners? Every little nit, they get antibiotics. They're just wiped out. It's a miracle they're standing. And when you take them off, everything disappears. They feel like $1 million, and they think it is something we did, but really it's taking away the poisons. All right, ferrum metallicum, toothache relief by ice water. Ferrum phos, if you have hot cheeks, inflamed, red, worse hot, that's a ferrum phos inflamed tooth. So if you have nothing else, pick that cell salt and stick it into your child's mouth when they come to you with an inflamed gum or cheek. Kali phos is great for a toothache when you're a high-strung person, nervous, emotional person. Sometimes people trigger toothaches from stress and anxiety. We're so tight. Our minds and emotions are so tight to our physical body. Kali self, things, toothache aggravated in a warm room, better in cold air. Mag carb is worse at night, and the patient must get up and walk around for relief. If you see someone pacing around at night, give them mag carb. Mag phos, a wonderful remedy with crampy. Anything with magnesium has cramps in it. Shoots like lightning, neuralgic, crampy pains. Intense pain that goes whoop, 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 increases with slight movement. Those are the mags, mag phos. And mag phos in hot water is like magic for Charlie horses and cramps. 30 seconds, cramps disappear. I kid you not. I had a client who was sitting there in the room on a chair, and she said, I've got these cramping pains. I ran to the kitchen, got her a mag phos in hot water. She goes, it's gone. It's wonderful. Plantago is a great one for sensitive teeth, Plantago major. Also urination, children who urinate in bed, have teeth that are very sensitive, worse cold, Plantago. Cilicia, worse at night. They're very cold people. They have abscesses that are trying to suppurate but can't, so it hurts like hell. Also garlic, chewing garlic really helps with pain, better than any painkiller when you have dental pain. Chew garlic. It's horrible for some people, but it kills the pain and infection. Pulsatilla, anytime it's intensified by heat. Merksol we talked about, Staphylococcus aureus we talked about. And then people have neuralgic pains. These are nerve pains that are triggered by dental problems, stress, chewing your jaw, TMJ, and there's no remedies like homeopathic remedies for this, guys. People have been taking all sorts of terrible drugs for trigeminal neuralgias, and they just make it worse and worse. Aconite, Arania diadema is great for pain on the right side of the face. You go into the cold, all of a sudden you have a hurt on the right side of your neuralgic hurt, Arania diadema. Children, severe pain in the night once you lie down, Arania diadema. Any cramping in your jaw, your mouth, Cupra metallicum is great. If you have a headache that goes from the back, like an occipital headache from the back of your neck nape all the way down and up, and then your jaws hurt, and you feel numb and dizzy, that's a gelsemium toothache and headache or neuralgia. Ignatia, in all, remember, Ignatia, nux vomica are headaches where you feel like a screw got put in from one side of your head. These are one-sided. It's like someone put in a drill into your head. That's Ignatia and nux vomica headaches, depending on the personality. Lachesis is very left-sided. Left-sided complaints, swelling, neuralgias, trigeminal neuralgias, things that happen on your left side, hard stuff, lachesis. Sore arms, heavy legs that have turned blue and purple, venous insufficiency on the left-hand side, lachesis, including left dental complaints. And lycopodium likewise is right-sided complaint. So if your child gets a toothache 4 to 8 in the evening, it's on the right side, try lycopodium. Magphos, as you know, is for cramping pains. Sanguinaria is a great remedy for right side neuralgic pain, especially people who have sinusitis on the right-hand side. Then they have dental pain, then they have trigeminal neuralgia on the right, they have polyps in their right nostril, sanguinaria. Migraines that are right-sided, wonderful remedy. And especially for people who have taken a lot of antibiotics and vaccines during their life, and they have right-sided stuff, it responds very well to sanguinaria. Same thing on the left, spigelia. So even if you remember one or two things, lycopodium is right-sided, 4 to 8. Lachesis is left-sided. Sanguinaria is right-sided, sinus, neuralgic. Spigelia is the same thing on the left side. Eye, cheek, left temple areas, blinding headache on the left side. Zinc phos has, again, cramping type pains, restlessness, sharp pains on the right of the head. Valerian, zincum valerian is on the left of the head. And people have, yeah, you had a question? No question.
I have a question.
Sure.
How do you determine between whether it's neuralgia or just regular pain? Because I've had like a low grade toothache that's kind of come and gone over the years for like a long time. And right now it's kind of back, but definitely low grade. I chew gingerly. I do kind of feel like I want to kind of worry it with my tongue. But like, how do you tell?
Yeah, neuralgic pains are generally gonna be spread because nerves are long. If it's pain in a spot, it's very likely an abscess, or do you have a root canal there or an amalgam there or something?
No. I mean, I definitely noticed my jaw has been more tight, like I've been gritting my teeth more. So
okay,
maybe that's kind of what's triggering it.
That could be. But if it's one particular spot, consider a deep dental abscess. You might want to try, high potency HAPAR or very high, HAPAR high potency. If you bite your jaw a lot, if you grind your jaw a lot at night, that might. But generally, those are grinding pains, and you'll have an ache or sharp pains that go through your whole jaw. And for that, these remedies are great.
Yeah, no, I think it's more localized. I mean, and x-rays in the past, they've never seen it. So
First, yeah. So I would try a combination of hypericum and something like a abscess. Do you salivate a lot? I mean, some others. No. So try HAPAR high, 1M for 10 days, and then hypericum.
Okay. Thank you.
If you have TMJ, bruxism, night chewing, a lot of vaccine injured kids will have bruxism, especially right after a vaccine. People say, oh, my child developed grinding. Part of it could be seizures they're having and they're grinding their teeth. Pain on chewing, ammonium carbonicum is great. If you have facial paralysis on one side or the other, ammonium phosphoricum is great. Belladonna is great for initial some viral paralysis. Your face falls on one side. or vaccine injuries as well. If you give belladonna right away, it'll be very helpful. Arnica, sometimes it's just tension, and arnica will loosen up your sore muscles, pains and sprains. For me, arnica is just magic. I don't get dental pain, but man, I hurt myself so much in so many areas. It feels so good. Belladonna, if you have abscess, grinding of teeth, fever, any kind of, so there's congestion. If you have neuralgic pains without the fever, then there's different remedies. If you have fever, that's a different remedy. And typically, if you have a toothache, some infection, grinding, and a fever, something like a belladonna will be very helpful. If you have cracky noises, many people have crackies coming out of their jaws, embarrassing, you hear stuff in your ears. A lot of submaxillary glands are swollen, a lot of stuff around the jaw area. Bad breath, teething got delayed when they were little, calcarb. And it's kind of like a constitutional, and you want to take it Banerjee style for a longer term, 1 m once a week for several months, or 200C every third day for several months. For me, it was very useful in asthma, allergies. My allergies are all gone. And it was calcarb, belladonna, helps with cataracts too, but general improvement of your immune system. Causticum is great for facial paralysis, difficulty opening them. Many people who can't open their mouths wide, causticum. You're clenched, your muscles get clenched. You're curled up, you can't unhook your elbows, your extensor muscles are paralyzed, that's causticum. Hepar is great for painful bleeding gums, anxiety, swelling, you're very sensitive to cold, you detect an infection, but you can't get to it, it's deep or deep-seated. Hepar high will get rid of deep-seated infections. Hepar low will suppurate them out, meaning it'll create a hole for them to come out of. Magphos, same. Your stiff jaws, the clenching after dental work in particular. You know, the dentist is holding you up with those forceps. I mean, holding you up with a clamp, your mouth open, and man, afterwards, you've never been well since. And you feel cramped at night, and it's better for warmth. That's Magphos in a hot water solution. If you're burning in your tongue while night grinding, podophyllum is a great remedy. Rhamnus is good for muscular pains, swollen joints, canker sores. Another good remedies, borax, and also Merck's soft. Canker sores is borax, especially children. You know, they get these foot and mouth disease and, you know, diseases caused by the vaccinations. Borax, Merck Sol, very good remedies, very good. 200, I would go with the 200 seeds. If you have looseness of teeth, meaning they're not anchored in properly, then go with the periosteal joint type remedies like Rus, Ruta. I would say Ruta here as well, depending on what it is. If you have dental pain and then your eyes are strained, what's been happening is my eyes, because I am now 60+ years old and I have a hard time reading up close and I hate wearing glasses, my eyes get strained, and sometimes I will have eye strain, and you could have eye strain expressing itself as jaw pain, and Ruta is magical. You know, people in third world countries that are reading by candlelight, their eyes are very sore. Or women who sew a lot or knit a lot, Ruta Grav keeps you from going blind, keeps you from having muscle fatigue and your jaws. Santoninum, headache, bad breath, thirst, loss of appetite, grinding of teeth. So this is a sort of body of symptoms that go together. Xerophyllum is wonderful. Headache, backache, TMJ, sinus pressure behind the eyes. Zincum metallicum, great for grinding teeth. Your kid grinds teeth, start with zincum. Doesn't work, go to cuprum 6C. It'll help. And there's a whole bunch of remedies for oral sores. If you have nothing else, guys, just keep borax and Merxol. These are different types of oral sores for different issues. You have cracks at the corners of your lips, you have canker sores, dry lips, and a coated tongue, that's Antimonium crudum. And tart, another great remedies, not just used for COVID and pneumonia. Tartaricum, Antimonium tartaricum, spelled correctly, by Candida, so yeast, that's yeast. Arsenicum metallicum, coated white, shows imprint of teeth, ulcers in mouth. Arsenicum is a great remedy. For me, Arsenicum iodatum. I love it so much. And if I have a lot of sort of digestive symptoms, or eat bad food and outside, or unwashed vegetables, and I have tummy problems, Arsenicum iodatum works really well for me, as this does for dogs too. Travis and me, we do very well in Arsenicum iodatum. Cracked sore, corners of mouth, there are many good remedies besides arum triphyllum, which is condorango and nitric acid. We've talked about them. There's bryonia for dry, cracked lips, yellow, dark brown coated tongue. Capsicum is great for oral herpes. It's great for when you have a cough and a pain in a far extremity. It's great. Capsicum is a wonderful burning pains. Herpes has burning pains. Cold sores have burning pains. Dulcamara, when you get cold sores, especially on your lips, and neuralgic pains. And you go down this. Merxol is great. Sulfuric acid is great for cold sores as well, or gums that bleed easily. And you want stimulants. You want hot tea or caffeine and all that. There's a lot of bleeding remedies for the tongue: arnica, arsenicum, bryonia, echinacea, naphmure, depending on the state of your tongue. So learn to review your tongue. If you have the front of your tongue looks like a strawberry, you probably have a rus tox problem. If you have very bad breath, red, dry, cracked tongue, dry throat, you're kind of sick, either you have high fever, low pulse, low fever, try pyrogenium. If the dog's heart is beating very fast and you suspect they're slightly feverish but not much, but their pulse is very high and you suspect an infection going from the mouth elsewhere or in the mouth, pyrogenium is great. Rus tox, anything related to the anchoring of the teeth into your jaw. Then there's dry mouth. A lot of people after radiation or chemo, radiation in particular, have dry mouth. And lycopodium has really helped. If you have no thirst and dry mouth, pulsatilla has helped. Arsenicum album works very well for people who have had other treatments and have dry mouth. Teething, calcarp, calflor, chamomilla for screamers, magphos for crampers, phytolacca for pain in the soft palates and swollen tonsils, and a uvula, you know, the thing that hangs between your mouth and your mouth, between your tonsils. It's drooping, it's kind of transparent, and it's all the way down to the bottom of your throat, and it's red and sore. That's phytolacca. Zinca metallicum, grinding of teeth, and that causes your teeth to get loose and gums to bleed. So look at what the presenting cause is, look at what the etiology is. Trauma could be from, you know, everything from golf balls and footballs to dental work, to food that you chewed wrong, to eating rocks and stones in your jaws. And arnica, apis, calendula, chamomilla. China, if you have a lot of body fluid losses, blood losses, post-surgery, lose a lot of blood, it won't stop bleeding, you take a pause, finally stops bleeding, you take China for the effects of the blood loss. If you donated blood, please don't feel bad for days, take China. Take China. If you give a lot of blood for blood testing, you know, these days they take 15 bottles for these basic blood tests. First, don't do that. But if you did that, take China afterwards. What else? Trauma, yes. Numbness, radiating pains are all hypericum pains. If the bleeding is, so you can, by the color of the blood, you can tell if it's bright red, it's a ferrum phos or a phosphorus or ipecac. If it is sort of dark blackish, it's cyclamen or hamamelis. That means venous bleeding is happening. A lot of vaccine damaged people from COVID have bleeding noses. And if it is stringy, purple, tricrotalis, if it's bright, triphosphorus or ferrum phos, if it is sort of purplish, and on your left side, trilachesis, these are the bleeders from various, or from the PCR thing too. I have an injury in my left nostril from the damn PCR, and it's still not properly healed. And I'm stumped. It doesn't bleed, but I have this feeling of polypus in my left nostril, and there's a stringy discharge that comes out every single day for the last several months. And I've tried so many things. It's getting better, but I suspect I ruined something that leads up to my brain there. Ledum from puncture wounds. You know, I should try ledum. It was a puncture of some sort. Why didn't I think of that? Yeah. Magphos or stiff sore jaw. So you get the picture. Bone, any kind of bone or periosteum trauma, symphytum. If I had given that to Roxy when her injury was like 1/2 a centimeter, I would have probably prevented this cancer that came out of there. It was horrible.
Let me ask you a question, because you're on trauma, and I have something I bought years ago, Traumeal, and I can't drink. I know arnica's. I believe arnica's in it, but I don't know what else is in it.
Oh, that's beautiful. Traumeal is the wonderful, wonderful trauma remedy. Should I check? I can check for you. It's in Traumeal, or you can check it for yourself.
I can check it, or if you want to. But when I saw the word trauma, it made me think of how much I used to use that.
Yeah, let me tell you what Traumeal
contains.
It is fantastic. Let's see.
I want to add something. After my dental procedure a couple of days ago, the surgeon told me that he applied 2 homeopathics. One was Traumeal and another was Ichthia, and I can't remember the rest of it, but he applied it directly to the area he was working on before he sewed it up.
Wonderful. Ichthyolinum. Okay, Traumeal, guys, contains Arnica montana, radix, calendula, hamamelis, bellis, echinacea, Echinacea purpurea, hypericum, aconitum for shock, chamomilla for heavy-duty pain, millefolium for bleeding, belladonna for throbbing, hepar for infection and suppuration, mercurius for bleeding and infections and salivation. So it contains 1, 2, 3, 4, 5, 6, 7, and I'm going to share this if you don't mind. Well, why don't I just tell you about it and then you will know. So 1, 2, 3, 4, 5, 6, 10, 15 different remedies. So it's awesome. Everybody keep some Traumeal.
Thank you.
It doesn't have Ignatia. I'm surprised by that. So it's more for physical trauma, eh, Sunshine? Although arnica is good for shock too. Aconitum is wonderful for shock. Yes. Yes. Alrighty. So your taste changes. Taste bitter. Borax is great for bitter taste with canker sores. Formalin is loss of taste in your mouth. Ignatia is when you have a sour taste. You know, when I was under stress, I would get bitter in my mouth, bitter taste in my mouth. It was literally, if I had a remedy at that time on hand, I would take tons of it. But at that time, I did not. I was at work. But I would get this bitter cotton mouth in my mouth from trauma or stress, and my taste would change. Nat Muir is a loss of taste. A lot of people have had a lot of loss of taste and smell. That's Kali Muir. I'm going to add Kali Muir because it's so prominent. Loss of smell and taste, especially post-COVID and post-COVID backs. Pulsatilla, toothache with bad breath, also has loss of taste. Salivary glands are disordered and you just don't feel as thirsty. And then infections. There are all sorts of remedies we talked about for infections. If you have black stuff, like fungal infections in your mouth, is nothing as wonderful as gunpowder. 3x will stop gangrenous infections in their track. For mucormycosis that happened in India from people that got antifungals for their COVID infections, so they would literally have black stuff coming out of their mouth. Gunpowder will stop that gangrenous fungal infection. Antibiotics, you give them steroids and antibiotics, and the fungal infections, sorry, the other way around. You give them steroids and antibiotics, and the fungals take hold. Fungus infections take hold, and they die from that. Happened to a lot of people, and things like gunpowder will help them. Myristica will prevent, and this is actually a very good remedy, and people don't use it enough. It prevents abscesses before the procedure. Swelling from the abscess runs down into the neck. So take that, so it keeps it from running down and infecting everything else. Myristica is a great remedy, and everyone should have it for infection. And people keep taking Hapar and Cilicia, but Myristica is probably a better remedy for some of those things. Bad breath. Calcarb, capsicum, caulifos, lycopodium, great for bad breath. Murk, smelly breath, excessive salivation, herpes. Nux vomica, anytime you have gastric disturbances and that causes bad breath, you're stressed out, nux. The pulsatilla bad breath is different. It's a thirstless and in a personality that's pulsatilla. Pyrogenium bad breath happens typically when you have high fever or you have an infection in your blood and you have very high pulse rate or low fever. Pyrogenium will, I had to give it to Travis once and he instantly calmed down. I couldn't find the lower potency. I gave him a 1M. In 10 minutes, he calmed down. His heart was thumping. He had an infection and instant results. If you have mercury fillings that you're removing, please recommend Merc Sol. It's isopathic, so you like same cure, same. So you're giving them Merc Sol to get the body pumped up, to get the mercury out if it goes into your body during the removal of the fillings, which it does. If you have excessive exposure to x-rays, take x-rays. Either, and that's preparatory or prior to your x-rays, before and after. Then there's a whole bunch of different things, allergic reactions, if you have allergic reaction, but you don't want to have procedures that trigger allergic reactions. You know, histaminium and apis are great if your throat closes. If you're doing implantation surgery, I would say, please do not do implantation surgery of any kind. And definitely don't take silica, because what will Cilicia do? Anyone take a guess what silica does? What does it do with thorns or bullets in your body? Anyone take a guess? It pushes them out. It pushes them out.
I was thinking fester, but
no, silica has the ability to push foreign objects out of your body. So if you have a thorn you can't reach, take silica, 3 or 4 doses. The next day it'll all pop out. So if you have dental implants, it is fatal to take silica. Or if you have pacemakers and such in your body, please be careful.
And if you have an implant in the knee?
Same thing. Be careful taking silica.
Oh, okay.
Understand the dangers of some of these things because your body doesn't want foreign things in it, and silica is going to push it out. If you have allergic anaphylactic reactions in any dental procedure, anacardium, keep it handy. You should have anacardium anyhow for poison oak here, 200, 1 m, small doses, large doses. Braces. First, try not to get too many braces. If you must, Ruta and Arnica are excellent to remove the pain instantaneously and help your body, your kids' teeth adjust to the braces. Dryness, do a calendula wash in any dental procedure. Cramping of jaw, they're holding your jaw. Magphos and causticum are great. Your jaw feels paralyzed, causticum. If it cramps, Magphos. You might get nausea from Novocaine or anesthesia. Zinzibur and agaricus are great. Phosphorus is great for that too. Actually, Nux vomica is great to antidote the effects of the drugs as well. Chamomilla is great for a local anesthetic as well. Magphos is great for cramps. Arnica is great for pain and injury. Bruxism, Senine 2 cream is great, but that's from parasites. And at night, your child keeps on grinding their teeth. They're itching in their anus. They're scratching in their nose. A dose of CNR 2 cream will fix the problem and take away the bruxism. Bruxism means grinding of your jaw. Any dental pain that extends to your ears, Merck and sulfur, Hepar sulf. Golden remedies, I should say, Hepar here. Fish sticks in your ears and your throats, wonderful. Kids, keep them on hand. If you have herpes, herpetic lesions, depending on the type of lesions, Graphites, Petroleum, Rux, Arsenicum album, the Valbosus family, Ranunculus, Merxol, and Borax are excellent for oral lesions. Christmas prevention, hypericum. Any neuralgic issues or muscle spasms, Cuprum metallicum. Temper tantrums, tuberculinum, butting heads, little children, they don't want, I mean, I can understand why they wouldn't want to go to a dentist, but temper tantrums, tuberculinum, chamomilla. I want to tell you the story of a homeopath who went to a woman in labor, and she was in a great deal of pain, and she had not really experienced homeopaths, and the homeopath is doing his case taping, right? And she's in great pain. She's like dying of the pain, and he's trying to figure out the remedy. And he says, so exactly how much does it hurt? And where does it hurt? And she said, come to me, I'll tell you how it hurts. The homeopath came to her, she slapped him hard. And said, that's how it hurts. He gave her chamomilla and the pain went away right away. So that kind of anger with your pain is chamomilla or tuberculinum. If you're feeling faint and lighthearted, Carbovegetablus is an absolute amazing remedy. 6C has worked wonders. And the recent COVID epidemic where kids were masked and faint, and you had these kids playing basketball in 100-degree heat in Larkspur. They could have used they were fainting like flies. They were wearing masks and playing basketball in 100-degree heat. Carbovegetablus, it'll revive dead corpses. If you have burns, urtica urens, and calendula, you drink scalding tea accidentally, or your child does. Calendula to soothe, and urtica urens to deal with the vesicles. Or cantharis if it's really burning badly. If you want to expel any foreign body stuck in your mouth, same thing, silica, but be careful you don't have implants in your mouth. Tooth reimplantation. Do not do any tooth reimplantation. Get bridges or go toothless. Yes, dentists will recommend this, that, and the other, but that is, what is it called? Putting lipstick on a pig, covering up a far more deeper seated problem, which is going to cause you lifelong injuries and ill health and chronic disease. Any questions? All right. If your pulp is exposed, you have exposed your nerves. So hypericum is the natural remedy. Ferrum phos will help also. If you have subluxated your tooth during trumps, moved around, ferrum phos, ruta, hypericum will help to nail it down. So if your child falls down, a whole bunch of teeth come out of his mouth, literally put them back in and give them ferrum phos, ruta, hypericum. There's a good chance they will root back in if you do it fast enough. Same thing with broken, with cut off fingertips. They'll grow back, guys. Put them back, give them hypericum, ruta, some phytum of bones involved, periosteal tissue. It'll grow back. That the fingertips are actually one part of our body that grows back, like a salamander. Many doctors don't know that. Abscesses prevention is pyrogenium before the process. First symptoms, you go Hapar, pyrogenium. If it's suppurating, low Hapar, low silicea. In the initial inflammatory stage, you give them belladonna and bryonia. If it's pus, Hapar salt really works well. Pyrogenium too, if the symptoms match. And you can drain pus with Hapar and silica. Fluorosis, calfluor, cell salt. This is when your parents were overzealous and fed you fluoride in the name of good health and just about gave you cancer and killed you. Your teeth turn yellow. You're trying to whiten your teeth. I have bad news, guys. They're not gonna turn white. The fluoride is deeply embedded in your teeth and they're gonna stay yellow. So don't waste your time, just keep them clean. But if you have fluorosis in a place where there's a lot of fluoride in the water, take calfluor, the cell salt. Tobacco weaning, palladium, tobacco making your teeth bad, lobelia, nux vomica for withdrawal. So there's a bunch of things that harm and hurt your teeth, and you want to take the homeopathic remedies that'll address it, so you don't have nasty tobacco teeth. Itchy upper palate, sabadia and vaitha. Vaitha is a great remedy. I've had very good luck with itchy upper palate, especially in.
So with the upper palate, I was drinking. Someone gave me a hot drink, and I didn't realize how hot it was, and my upper palate got really scorched. What can would that be good for that also?
That would be urtica urens. If it was sore and burning, urtica urens, or if it was extremely burning, cantharis. Vayetha is for itching palate, like when you have hay fever, allergies, and it just itches at the top of your palate. You have itching in your nose. You might have worms. Any kind of boils, abscesses, styes, myristica is wonderful. Everyone should learn about this remedy, keep this remedy, and use this remedy. If you have fever or herpetic blisters, apis every 15-20 minutes, vesicles filled with clear liquid. It's like a yellowish clear liquid in the vesicles, and then they kind of coalesce in your mouth. That's rust tox. Pus, crusty lesions, mesarium, cradle cap, mesarium. Wonderful remedy. Wonderful, wonderful remedy. Hypersalivation is jaborandi, but Merksol will do in a pinch. And now I think you have an overdose of remedies. It's very useful because a lot of this stuff applies to the teeth, to the rest of your body, and you're looking at homeopathic remedies from one perspective, that of your teeth. And that's helpful. That's helpful. Any questions? No questions.
I have one question.
Sure.
For delayed teeth and for teeth coming crooked, you mentioned calcarea carb.
Right.
That is calcarea carbonica.
Right.
Daughter, now she's getting teeth from here, both sides, you know. It's like
Right.
the upper jaw.
Oh, right. Second set of teeth.
So yeah, so it's coming here and it's like above the level of the canines, you could say,
Mm-hmm.
somewhere in between the canine and the incisor.
Right.
And it's coming into the upper, what do you say, this jaw, the lips, just
Mm-hmm.
behind that.
Mm-hmm.
So should I be giving calcarea carb because it's crooked teeth? But
Yes,
I don't know what it,
absolutely. Absolutely. Cal-carb,
but
Cal-phos, and raw milk. Raw milk will help a lot. A lot of these
cal,
teeth are already there before.
sorry,
A lot of these teeth are already there before, and so that'll,
for
yeah, they're just
for
coming out.
everyone, you mean to say?
Yeah, and so you just help them along.
So it will stay there only all the time now, or
Yes,
I
if
don't
it
know
is
what.
there, it'll stay there, but it'll come out properly. And then later
Mhm.
on, if it's bothering her, you can make a decision. If there's extra teeth, one on top of the other, you can make a decision to pull it out. But I would say avoid it whenever possible.
Mm.
You know, my daughter was told by this one dentist that she needed to have her 4 teeth pulled to make room in her mouth. But she went to a different person, Dwight Jennings in the East Bay, here in the Bay Area. And she has to not have to have them pulled. And he allows, I can't remember the name of the method, but he allows for the teeth to come all the way down. And she has a beautiful full set of teeth now without pulling anything and not having any crowding.
Yeah, that's the jaw expansion. That's fantastic. Too many parents got their teeth lopped off instead of expanding the jaw of the child. With resulting expansion of the pituitary on top, great mental and physical development happens. That was the assessment of Weston A. Price, the dentist, as well, that many people with narrow arches, if you expanded them, a whole bunch of other good things happened, as well as a good set of teeth coming out. Very good point.
So they do some kind of manipulation to increase the space,
Yes, yes.
or in like to make
Yeah,
room in the jaw.
exactly. They expand the jaw instead of contracting the jaw.
There's a special name for the procedure, and I do not remember it. But if you look up this Dwight Jennings, probably online, he has done interviews. He probably has that information online.
Yep. Yeah.
Okay.
And you know, when you have children with, say, there's narrow faces more and more in the industrial world, they're not getting the raw milk, the ingredients they need to have good dentition, good skeletal formation. Frequently you'll see this, but a lot of it can be addressed even later in life.
Mhm. So are you ready for any other statements or comments on something other than just the teeth?
No, so I am now gonna stop recording, so I have this consistent recording, and then